I have a picture I'll show you where I had a pretty gnarly bone graft and my face,
Yes.
I mean, it swelled up and yet nothing like when I had the All on X.
Right.
The All on X was,
And that's something, let's talk about that. I'm sure you're a pretty healthy guy, you look pretty fit to me. And you went through a bone graft and your face was swollen and, okay. Imagine what it's like for an older patient, a patient who's phobic, maybe a patient who has, other medical issues, blood dyscrasias or diabetes or things like that. Those patients don't heal well. So being able to avoid those types of sophisticated bone graft procedures avoids that kind of trauma. What we have seen is even in cases with very little bone, when we do all on X and angle the implants and give them the implants, or even with zygo and pterygoid implants, we hear patients come back because they're not being grafted with less swelling, with less post-operative discomfort. So when people say to me, oh, that sounds really painful, all on X, oh, you know what? That sounds really painful. What I tell them, surprisingly, patients tell me that they don't really feel the type of pain or discomfort or even swelling that they get from a standard dental surgical procedure. So in many cases, people most of the time are surprised. You spoke to Byron earlier. His wife, I don't know if he told you, eventually ended up having the procedure done as well.
yeah.
So she saw him go through it. He did the upper and the lower. And then once we finished her work, she then said, hey, it went great. He wasn't in a lot of pain, wasn't very swollen. I want to do it too.
Yeah.
So now we have husband and wife who've gone through the full upper and lower all on X therapy. And they're, as you could have told from the interview, very, very, very happy. But I'm sure if you didn't know better, you would just say, that guy has a great smile.
That's it.
Good looking guy.